If you are a man over 60 and you are sexually active in any way, including on your own, I need to tell you something that almost no doctor will sit down and explain to you directly. There are specific habits, specific patterns, specific physical approaches that men in this age group commonly repeat without realizing they may be contributing to real urological problems. Not problems caused by the activity itself, but problems caused by how it is being done and by physical changes in the body that most men over 60 have never been told about. I am talking about things like gripping technique and how it interacts with age-related circulatory changes. I am talking about timing patterns that can worsen existing pelvic floor weakness. I am talking about positioning habits that put unnecessary pressure on a prostate that has likely already changed significantly with age. These are not minor details. These are patterns I see again and again in my clinical practice. Men who come to me with urological symptoms, and when we dig into their full history, certain everyday habits turn out to be quietly making things worse. Today, I am going to walk you through 7 specific mistakes that are extremely common in men over 60, exactly why each one matters physiologically, and exactly what to do instead. This is not about shame. This is not about telling you to stop. This is about doing this safely, comfortably, and in a way that actually supports your urological and sexual health as your body changes with age. Stay with me through all 7 because some of these will genuinely surprise you. Hello and welcome back to the channel. I am Dr. Lila Romano, intimacy counselor, marriage therapist, and sexual health specialist with over 15 years of clinical experience working with men, women, and couples on exactly these kinds of conversations. If you are new here, welcome. This channel exists because most men over 60 have never had a single, honest, detailed, judgment-free conversation about how their body has changed and what that means for their sexual health practices. Your regular doctor has 10 minutes and a long checklist. I take the time here to actually explain the mechanics, the physiology, and the practical adjustments that matter. If you have been here before, welcome back. You know this is a space for real, detailed, evidence-based guidance. Before we get into the 7 specific mistakes, I want to explain briefly why your body at 60, 70, or 80 is genuinely different from your body at 30, because understanding that difference is what makes every single one of these 7 points make complete sense. 3 major physiological shifts happen in the male body with age that directly affect how sexual activity, including solo activity, should be approached. First, vascular changes. The blood vessels supplying erectile tissue naturally become less elastic and more prone to reduced blood flow with age, a process related to general arterial aging that affects the entire cardiovascular system, not just genital tissue. This means erectile tissue in a 65-year-old man is more vulnerable to certain types of mechanical stress than the same tissue in a 25-year-old man. Second, prostate changes. As we discussed in a previous video, the majority of men over 60 experience some degree of benign prostatic hyperplasia, or BPH, a gradual enlargement of the prostate gland. This changes the internal anatomy around the urethra and makes certain positions and pressures more likely to cause discomfort or irritation than they would have decades earlier. Third, pelvic floor changes. The muscles supporting urinary control, sexual function, and core pelvic stability naturally weaken with age unless actively maintained, similarly to how other muscle groups throughout the body lose tone without regular engagement. These 3 shifts, vascular, prostatic, and muscular, are the reason that habits which were completely harmless at 25 can become genuinely problematic at 65 or 75. Let's go through the 7 mistakes specifically. Mistake 1, excessive grip pressure. This is, in my clinical experience, the single most common issue I encounter when discussing this topic with older male patients. Many men carry the same firm, tight grip technique into their 60s and 70s that may have felt completely normal decades earlier without realizing that erectile tissue has become measurably more delicate with age. Here is the physiological reality. As vascular elasticity decreases with age, the smaller blood vessels and connective tissue within the penis become more susceptible to microtrauma from excessive compression. Urologists increasingly see cases of what is sometimes informally called penile microtrauma in older men. Small areas of tissue damage from repeated excessive pressure that over time can contribute to reduced sensation, scar tissue formation, and in some cases, worsening of erectile function. What to do instead? Use a noticeably lighter grip than you may have used in younger years. Many urologists recommend incorporating a personal lubricant specifically because it allows for a gentler, lower friction grip while still maintaining adequate sensation, reducing mechanical stress on tissue that has become more vulnerable with age. Mistake 2. Rushing. Due to time pressure or old habits. Many men developed fast, efficient habits decades ago, often during years when privacy was limited, whether due to family life, work schedules, or simply ingrained habit. This rushed pattern frequently continues into older age, even when there is no longer any practical reason for it. The problem is that rapid, high-intensity stimulation places sudden demand on a cardiovascular system that, in older men, may already be working harder to achieve and maintain adequate blood flow. Additionally, a 2015 study published in the Journal of Sexual Medicine found that men who engaged in slower, more gradual arousal patterns reported significantly better erectile function outcomes over time compared to men who consistently used rapid, high-intensity patterns, likely because gradual arousal allows the vascular system to respond more naturally rather than being forced into rapid demand. What to do instead? Deliberately slow down. Allow 10 to 15 minutes for the full process, rather than rushing through it in a few minutes. This is not just about comfort, it appears to genuinely support better long-term vascular and erectile health. Mistake 3. Ignoring lubrication. This is an area where I see significant resistance from older male patients, often due to the misconception that lubrication is unnecessary or somehow indicates a problem. The opposite is true. Skin elasticity and natural tissue moisture decrease with age across the entire body, including genital tissue. Friction that may have been entirely comfortable at 30 can cause genuine irritation, microabrasion, and in some cases skin breakdown in tissue that has become naturally drier and less elastic with age. This is simply a normal physiological change, not a sign of dysfunction. What to do instead? Use a quality, water-based or silicone-based personal lubricant consistently. This is not optional or supplementary for most men over 60. It is a basic protective measure that significantly reduces the risk of skin irritation and tissue damage. Mistake 4. Prolonged pressure on the perineum. This mistake relates directly to the prostate changes we discussed earlier. The perineum, the area between the scrotum and the anus, sits directly above significant nerve and blood vessel pathways supplying the prostate and surrounding pelvic structures. Many men, particularly those who use certain seated positions or specific types of pressure-based stimulation, place sustained direct pressure on this area for extended periods. In a younger prostate, this is rarely an issue. In an older prostate, particularly one already affected by BPH, sustained perineal pressure can contribute to temporary irritation, increased urinary urgency afterward, and in some men, discomfort that persists for hours. Urologists sometimes refer to this general category of symptoms as a form of pelvic congestion related to sustained localized pressure. What to do instead? Avoid prolonged sitting or pressure positions that concentrate weight directly on the perineal area for extended periods. If you notice increased urinary urgency, discomfort, or a dull ache in this region afterward, this is a signal worth paying attention to and adjusting your approach. Mistake 5. Neglecting the pelvic floor entirely. Most men have never been taught to engage their pelvic floor muscles consciously during sexual activity, and this becomes increasingly significant with age. As mentioned earlier, these muscles responsible for urinary control, bowel control, and ejaculatory function naturally weaken without active engagement. Many older men report a gradual decline in ejaculatory force and pelvic sensation over the years and assume this is simply an unavoidable consequence of aging. In many cases, however, this decline is at least partially related to pelvic floor deconditioning rather than an unchangeable biological inevitability. What to do instead? Incorporate deliberate pelvic floor engagement, essentially Kegel contractions, both during sexual activity and as a separate daily practice. A study published in the International Journal of Impedance Research found that men who practiced regular pelvic floor exercises showed measurable improvement in erectile function and ejaculatory control over a 12-week period, particularly in men over 50. Mistake 6. Using the same position repeatedly without variation. This may sound like a minor detail, but it has genuine physiological relevance. Many men, particularly over decades, settle into one specific position or angle out of habit and never vary it. The concern here is repetitive strain on specific tissue and nerve pathways. Just as repetitive strain injuries occur in other parts of the body from doing the exact same motion in the exact same way repeatedly over years, urologists have observed that some men report localized numbness, reduced sensation, or mild nerve-related discomfort that appears related to extremely repetitive, unvaried positioning over very long periods of time. What to do instead? Vary your position and approach periodically. This reduces concentrated repetitive stress on any single area of tissue or nerve pathway pathway and is a simple, low-effort adjustment with genuine protective value. Mistake 7. Ignoring warning signs and pushing through discomfort. This is, in my clinical opinion, the most important mistake on this entire list, because it is the one most likely to lead to a genuine medical problem if left unaddressed. Many older men have a lifelong habit of pushing through physical discomfort without examining it, a pattern often reinforced by decades of cultural messaging that discourages men from acknowledging or discussing physical symptoms, particularly in this area of health. When discomfort, pain, unusual sensations, or symptoms like blood in semen, persistent pelvic ache, or unusual urinary symptoms occur during or after sexual activity, many men simply ignore it and continue their usual patterns rather than treating it as the medical signal that it is. What to do instead? Treat any of the following as a genuine signal to stop and consult a urologist directly. Pain during or after ejaculation that persists beyond a few minutes. Blood in semen on more than one occasion. Significant new urinary symptoms following sexual activity, or any pelvic discomfort that is new, worsening, or recurring. These are not symptoms to push through. They are your body's way of telling you something needs medical attention. And addressing them early is significantly easier and more effective than waiting. I want to take a moment to address something that sits underneath everything we have discussed today. Many men in their 60s, 70s, and 80s carry significant shame around this entire topic. Shame that prevents them from asking questions, from adjusting habits that may be causing harm, and from seeking medical attention when something genuinely needs it. This shame was not created by you. It was created by decades of cultural silence around male sexual health, particularly in older age, where this entire topic is treated as either inappropriate to discuss or simply assumed to be irrelevant once a man reaches a certain age. Neither of those things is true. This is a legitimate area of health that deserves the same open, practical, evidence-based discussion as any other part of your body. You deserve accurate information. You deserve to understand your own body as it changes with age. And you deserve to feel comfortable seeking medical guidance when something does not feel right, without shame and without unnecessary delay. Let me give you the complete practical summary of everything we covered today, so you have a clear checklist to work from. Use a lighter grip than you may have used in younger years, and incorporate lubricant to reduce mechanical stress on more delicate tissue. Slow down deliberately rather than rushing through habit, allowing your vascular system to respond naturally. Use quality lubrication consistently, recognizing that this is a normal protective measure rather than a sign of dysfunction. Avoid prolonged direct pressure on the perineal area, particularly if you notice urinary urgency or discomfort afterward. Incorporate deliberate pelvic floor engagement, both during activity and as a separate daily practice. Vary your position periodically rather than repeating the exact same pattern for years on end. And most importantly, never ignore pain, blood in semen, new urinary symptoms, or persistent pelvic discomfort. These are signals worth a direct conversation with a urologist, not something to push through silently. None of this is about telling you to stop or to feel ashamed of an activity that remains a healthy and normal part of life at any age. It is about doing it in a way that genuinely supports your body as it is today, not as it was 30 or 40 years ago. Let's bring this all together. Today you learned 7 specific habits that are extremely common in men over 60, and exactly why each one matters given the real physiological changes that come with age: vascular changes, prostate changes, and pelvic floor changes. You learned practical, specific adjustments for each one, and you learned why ignoring warning signs is the single most important mistake to correct, because early attention to genuine symptoms makes an enormous difference in outcomes. Here is what I want you to take from this video above everything else. Adjusting these habits is not about restriction or shame. It is about working with your body as it is today rather than against it. A few small, deliberate changes, a lighter touch, a bit more time, the right lubrication, attention to your pelvic floor, and genuine attention to warning signs can make a meaningful difference in your comfort, your function, and your long-term urological health. If this video gave you something genuinely useful today, please give it a like right now. It helps this information reach the men who quietly need to hear it, many of whom have never had anyone explain this to them clearly before. Subscribe if you are not already part of this community. I publish every week on men's health, sexual wellness, and the honest, detailed conversations that matter most as you age. And leave me a comment. Tell me what surprised you most from this list, or what other topics you would like me to cover. This channel exists because of conversations conversations exactly like this one. Coming up next on this channel, the 5 urinary symptoms men over 60 should never ignore. What your urologist actually checks for during a prostate exam and why it matters. And the truth about testosterone replacement therapy after 60. Until next time, take care of your body, listen to what it is telling you, and remember, understanding how your body has changed is not something to be ashamed of. It is the wisest thing you can do for yourself at this stage of life. I am Dr. Lila Romano. I will see you in the next one.